Lecture 3: Precisions on Oncology in Leukemia and Lymphoma, titled Tailoring the Fight: Precisions on Oncology for Hematologic Malignancies. Historical context: leukemia and lymphoma were once treated with one-size-fits-all chemotherapy, with outcomes varying widely. The 1970s discovery of the Philadelphia chromosome in chronic myeloid leukemia (CML) marked a turning point, revealing a specific gene driver, BCR-ABL. Imatinib 2001, a tyrosine kinase inhibitor (TKI), targets this meeting's transformation CML into a manageable disease. This success created the search for other actionable mutations. Current advancements: next generation sequencing NGS now profile tumor for mutations like FLT3, ADH1/2 and 2, and TB53 in 8 myeloid leukemia, AML or MUC, and BCL2 in lymphomas. Targeted therapies: venetoclax for BCL2-driven cancers, midestrolls for FLT3 mutated MLL improve survival when paired with NGS-guided diagnostics. Located biopsies detect many residence disease (MRD) via circulating tumor DNA, allowing real-time therapy adjustments. In CLL, protein tyrosine kinase inhibitors, e.g., ibrutinib, outperforms chemotherapy. Multi-omics, genomics, proteomics further refines patients' stratifications. Challenges and future direction: resistance and targeted therapies, e.g., BCR-ABL mutations, require competition strategies. INGS costs and bioforms demands limit adopting in resource-poor setting. MRDS prognostic value need standardizations. Future efforts focus upon cancer biomarkers or driven mutations predictions and integration social determinations of a health of research models to address disparities. Takeaway: percentage oncology personalizes care, but its success depends on overcoming resistance and access barriers.